This is Nightline.
Tonight, state of testing across America, a game of catch-up on COVID-19 to quarantining the sick, spotting those with immunity, and jump-starting the economy, with some taking matters into their own hands.
I think now it's got to be all hands on deck.
The lack of national testing has forced states and private companies to fill the gap.
I'm getting ready to see the patient, so I have to wear my equipment. Everything is in the car.
Dr. Iman Bar is a concierge doctor in Southern California who says her schedule is now jammed with COVID-19 house calls.
So if you can keep that, like the mask on your mouth, but not on your nose.
Over the weekend, Dr. Bar and teams from local labs were busy administering tests to these Manhattan Beach first responders, conducting both the nasal swab to detect those currently infected and the antibody test to see who has immunity.
What role do you think you're playing right now in getting people like these guys back to work?
So I see myself as a provider that serves in the community to be able to make sure that nobody's spreading the infection as well.
If you learn that you do have the antibodies, will that give you a sense of confidence?
I think it'll just at least make me more reassured when I'm around. You know, I have young kids at home, and both my wife and I work, so we rely on them, and also a daycare to watch our kids. So it gives me some sense with that because they are, you know, in that at-risk population.
Everybody's at home, huh?
No, pretty much quiet shifts.
There's a concern that because you are on the front lines, you are responsible, and you know, some of these guys might be spreading it.
We know the risk that we take when we come to work. It's a new experience for us to take that risk home to our families.
Getting people tested on a large scale has not been easy here or pretty much anywhere.
You know, here in Los Angeles, like so many places, we were just left on our own. There was no tests that were being delivered from the federal government. So we had to step up and figure this out ourselves.
So is it back to business or backtracking on COVID-19? What role does widespread testing play for restarting the economy? Earlier today, I spoke to ABC News contributor and former Homeland Security advisor to President Trump, Tom Bossert, and ABC News chief medical correspondent, Dr. Jen Ashton. Thanks you both for joining us. Jen, let me start with you. It's been more than a month since President Trump said anybody who wants a test can get a test. And yet we keep hearing widespread complaints from sick people who are still unable to get tested or are waiting days for results. Why is it so important for nationwide, consistent testing online to be quick?
Well, so many reasons, Juju. First of all, we need to get rapid results, meaning within 5 or 15 minutes, so we can go through the basic 4 steps with an infectious disease outbreak. We need to be able to detect, diagnose, isolate, and treat people who test positive. We also know, based on new data that's just come out of Iceland, where because they have such a small country, they're testing basically anyone who wants to get tested, that now as high as 50%, half of people who test positive may show no symptoms at all. So we also need to be able to test a lot of people in order to track silent transmission and know where this virus is.
That has a lot of implications. Tom, you know, the U.S. lost weeks of precious time getting testing up and running compared to other countries like Germany and South Korea, which allowed them to contact trace. What lessons can we learn from those other countries, and how do we make up for that lost time?
I think the biggest lesson there is that we don't want to repeat the same mistake twice. We're going to have to come up with a plan that allows us to use those tests on people that may be symptomatic but don't feel really that bad. So the idea of changing the standard, to Dr. Jen's point, of who gets the test will help us improvise to make up for this scarcity of tests that we're seeing and this competing need to get back to work.
And Jen, we're seeing a number of major studies being launched on antibody testing here in the U.S. Does the presence of antibodies mean you're definitely immune? And how long might that immunity last? Because there are now reports that some people are testing positive twice.
Exactly. And we have to remember this virus is barely 4 months old. So we're still learning a lot about it in real time. And we're extrapolating a lot based on what we know from other coronaviruses. So in general, those antibodies, when we're exposed to an infection, tell us kind of 3 or more, a few more categories of people. It tells us who's susceptible, who may be actively infected. You sometimes can tell that with antibody tests, and who has recovered. But what we don't know with this particular virus is when those antibodies show up, how long they last, and how powerful they are, or even if they convey any degree of immune protection against that virus down the road.
Tom, beyond testing for the virus, the FDA has approved a company to roll out antibody tests, and we know how crucial that is to see if people have been exposed to COVID. But how crucial is knowing antibody status as a roadmap for getting back to business?
We won't have perfect knowledge, but we're going to have to make decisions. We can't wait for that perfect knowledge. That's kind of the mistake we made the first time. And so to Dr. Jen's point, we're taking the lessons of history. We're assuming with high degree of credibility, and a lot of doctors that have studied this, that people that have been exposed and who have recovered are going to have some degree of immunity.